So people have generally have chest pain, or we call it as angina, and we investigate this by a procedure called an angiogram, where we put some dye into the coronary arteries to see if there are any blockages. Currently the waiting time for this is about 45 weeks or so, and once we identify the blockage, then the treatment is just putting a balloon and stretch it open and put a wire mesh called a stent inside. And the current waiting time is roughly very similar, about 45 weeks to 50 weeks to have the procedure done.
I first found out that I needed hospital treatment in January 2018 when my doctor from Tavyside Health Centre in Tavistock referred me to cardiology at Derriford. Prior to this, I'd had several chest pain events, two of which were severe enough to have the ambulance attend to me at home. At my age, I found it very stressful, partly because of the number of visits I've had to hospital prior to anything being done, and I just hope that finally I'm going to be dealt with today.
So Charles has been having a lot of angina, which is chest pain, and he had an angiogram which shows that he's got a very tight blockage in one of the branch of his coronary arteries, which really goes to the back and the side of his heart. So he's been quite troubled with angina, and hence he came for the procedure today. He's been now waiting nearly for 53 weeks to have the procedure done. In fact, he came last week and it got cancelled because we had immense operational pressure within the trust.
Good morning. Good morning, I'm Sharon. Just probably please sit on second. Then you will be sterile.
You're going to feel a little bit of push. Are you comfortable down there?
Yes, thank you.
What do you like to be called, sir?
Charles?
Charles. Okay.
Slight chest pain,
Okay.
nothing much.
Okay. So if it is too uncomfortable, let me know.
Nothing. This one.
Okay. I'll give you some painkillers, alright? This is a stent which is being crimped on the balloon. Which is made up of a metal alloy, where we have put it into his narrowing of the coronary arteries and stretched it open so that it acts like a scaffold to prevent the artery from re-narrowing. So hopefully this should really help him with having less angina on a daily basis, and in the shorter or longer term he can come off some of the tablets which he's been taking. So hopefully he should have a better quality of life from the procedure he had done today.
On comparison, I'm feeling better. I'm glad that I had the operation done. The whole process was more or less as I expected. I would suggest that if this new unit is up and running and well staffed, it must have some effect on the long waiting lists for people in my position waiting for angiograms and angioplasty. So I'm all in favour of another unit, whether it's in a car park or on the helipad.
So this new facility is called the Regent, also called the Peninsula Heart Centre, is coming with a cath lab and a co-located day case unit, and we are planning to treat about 1,000 patients a year, and it is going to be predominantly functional 3 days a week, and hopefully the new facility will offer a very timely access to treatment and reduce the waiting time immensely.
The new cath lab will be a joint venture between Regent's Park Healthcare and University Hospitals Plymouth Trust. It's a joint venture which brings benefits really from the private sector as well as the NHS, but it allows the NHS to still retain control in terms of how that facility is used for our population. So the new cath lab will be open in May 2019, And with this extra capacity that we will have available to us, we will be able to bring our angiogram waiting time down to hopefully 0, which will be a really big achievement to our local staff and much better healthcare for our patients. And it will also allow us to be able to provide an angioplasty service within the 18-week treatment time. So the funding streams for the new cath lab will be through the normal routes in terms of commissioners, and it will not be costing us any more money, with a proportion of that money going to Regent's Park for obviously the services that they will provide. I'd also like to say a big thank you to Heartswell, one of our local charities, in terms of their support, in terms of what they have offered to allowing this plan to become a reality.